Thank you, Madam Chair. Thank you for giving me an opportunity to discuss something that's important to me and my constituents. I'd like to give this announcement and provide a little bit of an update on a hearing order last week with Councilor Murphy regarding a for-profit urgent care center proposal on West Broadway, less than a block from the South Boston Community Health Center. As you all know, we also called for this hearing in the wake of Stewart healthcare crisis and similar concerns on for-profit healthcare and the ripple effect it has on access and quality. Thank you to Councilor Fitzgerald for bringing us together today at the county hospital to discuss this issue. I talked about concerns for my constituents across South Boston as it relates to South Boston Health Center, including our seniors, persons with disabilities, communities of color, immigrant neighbors, our most vulnerable in BHA public housing, developments in Muriel and McCormick, where I was last night, talking to residents with former Councilor Kenzie Bork, West Broadway, West 9th Street, Old Colony. At that time, I tried to sound the alarm and warn that this could be the first shoe to drop if we have for-profit urgent care facilities in my neighborhood, possibly with investments like we're seeing across the country and across the city with private equity firms, venture capital funds. They could eventually look to pop up a block from other community health centers across the city. In my district, city councilors know the critical role they play in their neighborhoods, threaten the health services they provide, cutting staff, services, programs, like the Codman Square, South Cove, Bowden Street, East Boston, Fenway, just to name a few. But to get back to my point, the proposal in South Boston was highly unusual from the start. An abutters meeting date and zoning board of appeals date a week almost apart for the largest for-profit urgent care company in the country was going to come to South Boston, and a vote was going to take place at the ZBA. But through the advocates and advocacy of my neighbors across South Boston and South Boston elected officials, we were able to breathe a sigh of relief that the proponent formally withdrew his request at the zoning board yesterday. Unfortunately, this good news for public health and my constituents was short-lived. As I read a news report late last night that the BPDA had recommended approval of this for-profit urgent care clinic in a memo that they sent to the ZBA. I was in shock and disbelief when I read this before tracking down the memo and reading it for myself, where it made, and there's no other way to say it, a dishonest leap that the largest for-profit urgent care company in the country, that it made sense on West Broadway due to its close proximity of the neighborhood community health center, as if they complement each other. It was the first reason they listed. This is unconscionable. I am concerned about this and communicated as much this morning and last night to the mayor's office, to the BPDA. So I'm going to be as polite as I can, but I think everyone knows here and in the city, if you come after my constituents, well, then be prepared for battle. We call ourselves the most progressive city in the country, and after all we have heard for 15 years about the profit motive in healthcare, the BPDA was ready to recommend and stick the largest for-profit urgent care company in the country a block away from the nonprofit health center. Incredibly short-sighted. It would have put the public health of the town at risk in the long term. In the final analysis, the South Boston Community Health Center has been invaluable to this community, 50 years, serving 70,000 patients annually, while the largest for-profit urgent care company in the country offers a fraction of the services and can pack up and leave at any time if they're unhappy with their profit margin, and we're all left to pick up the pieces. This was not a close call. The BPDA showed poor judgment and ruthless disregard for the welfare of the people of South Boston, and I felt I owed it to my constituents and the residents of the city to express my severe disappointment with BPDA for this terrible recommendation that they made. It happened in South Boston. It could happen in your district as well, unless we stand together and let the BPDA know that community health centers are part of our city. They're part of our community. They provide critical health care to residents in need. As I mentioned, communities of color, immigrant neighbors, residents in BHA. Short-sighted for this BPDA team to do that. I met with them today, and as you probably can tell, I'm disappointed, and I'm still looking for more answers from the BPDA team. Thank you, Madam Chair.